800,000. Just think about that for a second. That is the staggering number of people in the United States alone who are affected by a stroke every single year. It's a massive number, and it represents hundreds of thousands of lives suddenly and often drastically changed in a matter of minutes.
Welcome to The Explainer. Today, we're demystifying something that touches so many of our lives, strokes. We're going to break down exactly what a stroke is, what's physically happening inside the body, and most importantly, why every single minute matters in the race against time. Okay, let's dive into this.
Here's our game plan for today. We'll start with what a stroke actually is, then we'll get into spotting the warning signs, understanding the risk factors, what emergency treatment looks like, and finally, prevention and recovery.
Section 1. What is a stroke?
So, at its core, a stroke is a massive medical emergency. It happens when the blood supply to part of your brain gets blocked, reduced, or a vessel just bursts. And here's the absolute kicker. This disruption cuts off the vital oxygen and nutrients your brain tissue desperately needs. Without that oxygen, brain cells literally start dying in minutes. Not hours, guys. Minutes.
Think of it kind of like a major plumbing disaster. On one hand, you've got an ischemic stroke. That's basically a blocked pipe. A blood clot or some fatty plaque just clogs up an artery, totally stopping the blood flow. On the flip side, there's a hemorrhagic stroke. That's your burst pipe. A blood vessel in the brain actually ruptures, leaking blood everywhere and putting intense pressure on those super delicate brain cells. Now, to put this into perspective, the vast majority of strokes, like 85%, are ischemic, so mostly blocked pipes. Only about 15% are hemorrhagic, but make no mistake, they are both incredibly dangerous.
Now, you've probably heard people say mini-stroke. The official medical term for this is a Transient Ischemic Attack, or TIA. This is a temporary glitch, a drop in blood flow that might literally only last 5 minutes, and it doesn't leave permanent damage. But listen, do not brush this off. It is a massive blinking red warning sign that you've got a plumbing issue and a severe stroke could be right around the corner.
Moving into Section 2, spotting the warning signs.
Okay, you've got to pay really close attention to these red flags. The key word you're looking for here is sudden. We're talking sudden trouble speaking or understanding what someone is saying to you, sudden numbness, weakness, or paralysis. And notice this, it almost always affects just one side of the face, arm, or leg. You might also notice sudden blurred vision, a really sudden severe headache out of nowhere, or a sudden loss of balance. If you see any of this happening, even if it seems to stop, you've got to act.
To make this foolproof under pressure, doctors use this brilliant little acronym, and I need every single one of you watching to memorize this right now. Think FAST. F is for face. Ask them to smile. Does one side droop? A is for arms. Have them raise both arms. Does one kind of drift down? S is for speech. Ask them to repeat a simple sentence. Is it slurred or weird? And T is for time. If you see literally any of these, don't wait around to see if they feel better. Call 911 immediately.
Section 3. Understanding the risk factors.
It really helps to look at what we can control versus underlying medical conditions. On the lifestyle side, things like being overweight, skipping exercise, heavy drinking, or using illegal drugs, those stack the deck against you. On the medical side, high blood pressure is practically public enemy number one. Then you've got high cholesterol, poorly managed diabetes, sleep apnea, and honestly, some newer research even points to a COVID-19 infection bumping up your risk for an ischemic stroke.
Then, of course, there are the things you just can't change. Age is huge. If you're 55 or older, the risk goes up. Race factors in too, with African American and Hispanic folks facing higher risks. And there's this really interesting paradox with sex. Men are more likely to have a stroke overall, but women actually tend to be older when they get them, and sadly, they're more likely to die from them. Factor in family history or things like hormone therapies and birth control pills, and you really start to see a person's individual risk profile.
All right, Section 4. Emergency treatment and care.
From the second you roll through those ER doors, it is a race. First, a rapid symptom review and physical exam. Then, boom, you're rushed to imaging for a CT or MRI scan to get a literal look inside your brain and arteries. They'll probably do an ultrasound on your neck, draw blood. It is all happening at lightning speed because doctors need a diagnosis yesterday. They have to know, is this a blocked pipe or a burst pipe? Because how they fight it depends entirely on that answer.
And here's why getting that right is absolutely crucial. The treatments are complete opposites. For an ischemic stroke, the blockage, they need to get the blood flowing again, fast.
They might use IV clot-busting meds, or even snake a tiny little plastic catheter up into the brain to literally pull the clot out. But if it's hemorrhagic, the burst pipe, they have to get the pressure down immediately. We're talking emergency meds to drop blood pressure and stop bleeding, or sometimes even emergency brain surgery to clear out the blood.
Section 5. Prevention and stroke recovery.
We really need to talk honestly about the aftermath here. Surviving a stroke is incredible, but it can leave you with some real hurdles. This could mean physical paralysis on one side. It could mean having to relearn how to talk, swallow, or even process language. A lot of folks deal with memory loss, sudden emotional shifts like depression, or just weird tingling pain in their arms or legs. It takes a massive toll, both body and mind.
But here is the most important takeaway. You are not alone in this. Recovery is a massive team effort. You've got neurologists, rehab specialists, and your friends and family all pitching in. It takes hard work, it takes time, but the whole goal is finding your new normal, and honestly just celebrating every single little victory along the way.
Okay, let's talk about what you can do right now to protect yourself. These are highly actionable, everyday habits that act like a shield against strokes. Number 1, get your blood pressure under control. Eat plenty of fruits and veggies. Think Mediterranean diet. Stop smoking like yesterday. Manage your weight and your blood sugar. Try to get 150 minutes of exercise a week. Just get up and move. And if you drink alcohol, keep it strictly moderate. Simple stuff, but it's a total game changer.
Now, if you've already had a TIA or a stroke, your doctor might bring in some pharmaceutical reinforcements to keep things flowing smoothly. They might put you on antiplatelets, like aspirin, which basically makes your blood cells less sticky so they don't clump up. Or they might use anticoagulants, blood thinners like warfarin, that literally alter the chemistry of your blood to stop it from clotting so easily. I want to leave you with this one thought. Every single minute counts. The longer a stroke goes untreated, the worse the potential for permanent brain damage and disability gets. In the medical world, they literally say, time is brain. So, now that you know the FAST warning signs, if the clock starts